I'm very lucky to have had a phenomenal medical team, and a team that not only gave me all the time that I needed and answered all the questions that I needed answered, but spoke to each other and really functioned as a unit that was fighting my cancer with me. I know that I'm so lucky. I know that everybody doesn't have that. I think in making this documentary, I've heard a lot of stories I don't really like. And I've heard a lot of stories, that are good. But I think people should not be afraid to ask their doctors questions. People shouldn't be afraid to do their own homework and present them to their doctors. I think doctors need to be open to those things. I think that patience and listening on everyone's part is very important.
In terms of the treatment and the care, there seems to kind of be a roadblock. I think that people go to their doctors, they receive a medical plan, and they're left with that. And I think sometimes it's a totally just, correct, wonderful, and then sometimes I think there can be other things that are done. I think with the internet it's hard because you can just over-research and drive, I'm sure, your doctor crazy with, I read about this study and this study. But I feel like it would help if there was some network, especially with these experimental trials, which I think are a wonderful way to create new forms of therapy. I think if there was some sort of resource, watching my dad go through the way he was able to talk to people is because of who he was, right? Doors were opened for him because he was a scientist and knew these people intimately. And I think if there was more of a way for people who don't have that to still have the resources to know which trials are being done at which research labs, which they're able to be on, understanding the risks, because obviously there are risks with that, just as there are with chemotherapy and radiation. I just think it would help to have some sort of network and knowledge about it. I think most people go to their doctors and just think, okay, this is it.
I remember her just so angry at, I think she got a voicemail from the doctor, telling her that the cancer had come back. And I think that's what set her off on more of a homeopathic route, because everything felt so factory, based treatment with going back to chemo. And she didn't, I think for her, she didn't want to just be another percentage. And it just didn't feel like she was getting answers.
I think sort of the bedside manner of any physician, be they man or woman, is to look into the personality of the patient and see how to handle that patient. I mean, there are women who are strong as you, but you're not always that strong either. There are times when, you have to kind of, depression will set in, even for a split second. But there are, I think people have to be dealt with on an individual basis, not just as this is how we will treat everyone. I think some people can handle a sense of humor. Some people can be, strong, and you can deal with them on a very, very logical level. This is what's going to happen, and all of that. Some people can't take that. Some people can't take the fact that they're going to be, different for the rest of their lives.
So you have someone who's has cancer and they're stressed out and they're nervous and they're worried, and they call and they get someone on the phone that says, I know this happened to my mom, and where they have a bit of an attitude, or they're, I can use a word that will get bleeped out of the of the interview, but they could be kind of unpleasant, and maybe they're stressed out on their end, and that happens, and people have bad days. But I think it's important I think it's very crucial that the person on the other end of the phone that the patient is calling to make the appointment or to make arrangements or to ask questions for the doctor, that has to be someone who has been trained to answer calls appropriately to make the client feel good and not get short with them and or bitchy or or rude, which happens. And I don't think that's appropriate. I think that's something that doctors should really keep tabs on.
The entire staff of any medical office needs to be in line in terms of knowledge and emotion. Because when you walk through the door of any medical office, if you're fighting cancer, you need a smile when you walk through that door. You need it from the parking attendant, you need it from the person at the front desk, you need it from the person who's taking someone's temperature and their blood pressure, and you need it from the doctor. The last thing any cancer fighter needs is to feel like they're dealing with someone who's in a hurry.
Remember that these are people and that they come to you because they need your help. And please don't forget that. And that, we should be servicing their needs, not your needs. Like I think you and I talked, or we talked one time about maybe those parking spaces adjacent to the entrance to the hospital or the medical building should be reserved for patients and not for the doctors. Gee, what a concept. People who are healthy, maybe they can have the top floor parking and we reserve the ones that are close by for the patients who are sick. I mean, that's a little thing, but gee, maybe that's the sort of philosophy that we need to follow through in all of these, in many areas of the health profession.